So the question, I guess, both for me and for you, Bill and Jarek, so I think you can unmute yourself and we will answer that together. Both REHVA and ASHRAE do not pay a lot of attention to the horizontal airflow and direction. This seems to be an important factor in the super spreading. What is the opinion of the panel about this, and should this item get more attention in guidelines? Do you want to answer that?
If I can start, yes, in our new guidance, we have put a limit for the velocity. It's 0.3 meter per second, what we see as a threshold for this type of mostly horizontal airflow, or any direction what it can be. But to control in the air distribution design, this 0.3 meter per second is now recommended in our guidance.
Okay, so in the fourth version of the guidance, right?
Exactly.
Okay. In ASHRAE, do you have something on this?
Yeah, well, and of course, I mentioned that we have in our guidance a statement to avoid strong horizontal air currents that can cause transmission from person to person. So it's the same concept. We haven't quantified it with a specific velocity limit, but not using personal fans and pedestal fans that are sometimes used for ventilative comfort cooling in indoor spaces is discouraged, because we've seen evidence that that's important. You know, something general about air distribution is that to a large extent during the pandemic we're stuck with whatever a building has. I think some of these considerations about air distribution may become very important in thinking about what standards will look like in the future.
Okay, yeah, thank you. I think it will have an impact in the future standards, definitely. To know if we are effective on any application, we need to monitor, as I see it, CO2, PM, and humidity. I see a lot of ideas and applications being applied, but I am not seeing a result published with the real-time monitor. What is recommendation from both sides?
I don't think ASHRAE or REHVA believes that manipulation of humidity or temperature is very important in mitigating COVID-19 based on looking at all the evidence. So I don't think that's critical. PM, you can monitor it, but I'm not sure that having an infected person in an indoor space is going to change the background PM profile. So I don't think you can determine that there's an infected person there simply by looking at PM levels. And CO2, to the extent that it tells you something useful about ventilation rate, is important, but we should discuss that issue perhaps, since it's a point that REHVA speaks to and ASHRAE is silent about.
Yeah, do you want to add something on it, Jarek?
Bill did it very well, yes. CO2 is just a useful proxy for ventilation, and that's indeed already now used in many buildings to be measured, and when you control your airflow rates based on the CO2. And indeed, in demand control systems, it's important to overrule when these settings so that these systems will operate at full capacity. This is also one aspect what needs to be taken into account.
I think this is one of the things that we go back and forth in our thought process. The demand control ventilation for odor, where every person in the space is a source, makes a lot of sense, because now you're controlling the ventilation per person. But if you have one infected person in a space, it doesn't matter whether you've got 10 uninfected or 5. Each of them has the same risk of airborne exposure based on the Wells-Riley model. So that's why we're not so clear on whether it's possible to set a CO2 set point for infection control. And if you look at healthcare, they use air changes, not ventilation rate per person as the basis, and I think that may be the reason why.
Yeah, that's a good point. But let's say, especially in buildings which do not have ventilation systems, this CO2 is still a good indicator. When you will need to open a window or to arrange some other area to have ventilation.
I think
Perhaps in Europe we have more such buildings which do not have ventilation systems and very much rely on the window opening.
It's a good way, I think, to determine the air exchange rate under conditions that you understand. I'm just not so sure about it if you don't really have the other factors to put together with it. But I wouldn't recommend pushing the quantitative conclusions regarding a particular level too far.
Yeah, well, yeah, I think again it's a case-to-case things to think about, because yeah, there is no ventilation, no air cleaning system, no recirculation, but actually you cannot leave the windows open all the time. Then you need something to tell you when you really need to open the windows, and that's what they want in a lot of classrooms in Europe, I think. So yeah, one could argue that they just have to buy air cleaners for their room, but it may not be that heavy. CO2 sensor, well, we stay on CO2 sensor, obviously come at a cost and will need to be recalibrated to be accurate. Are there many options that are cost effective? So this is more for you, Jarek, I guess.
Yeah, I think these are in these days already pretty good. So for €100 sensor, you can expect plus minus 50 ppm accuracy. And indeed, they will need calibration perhaps every second year or something like that. So these sensors have developed quite nicely.
Okay. So for €100, you said plus or minus 50 ppm, right?
Yes.
Okay. So, yeah,
I think what I'm hoping is that we can eventually not have to use CO2 sensors to essentially count people in a space. And I think that technology, alternative ways of doing occupant counts, is really making good progress.
Yeah. Okay, and we are running out of time, so I think we will just take the last question and close the meeting. How natural ventilation through windows will be used in classroom, residential dwellings, and office buildings?
Yeah, this is not very easy to provide any general recommendation, but we have recommended keep windows open at least for 15 minutes, and open the window if you are going to the room somebody else has left. Then do this 15 minutes intensive window airing. So this is a kind of general guidance we have provided.
Yeah, general recommendation by REHVA to keep the windows open at least 15 minutes between its room change, basically in schools or things like that.